Let's see what your hearing aids look like and what kind they are.
Well, this is more of the traditional, what we call the custom in-the-ear type of hearing aids, which is the occluding type of hearing aid. And that felt really good to take that out of my ear just now, because it felt like I had an earplug in there.
And how about your other ear?
And the other, I'm wearing one similar to what Dr. Johnson is wearing, which is the open canal or open ear type of hearing aid.
Now, why wouldn't you use that as a selection every time?
We do probably 80% of the time we use this. Why not? A lot of times people are reluctant to go with something like this. They've maybe worn this type in the past and it's what they're accustomed to using. It's hard to switch horses sometimes.
How important is it to adjust the hearing aid? Tell me about the advances. My understanding is you put a hearing aid, everything may sound loud. How do you adjust what the person's hearing?
Well, we know by the hearing tests the frequency range that's deficient, and usually it's the higher frequencies. And the hearing aids are all digital now. We work with them off of the computer, and we program into the hearing aid the exact specifications for that person's hearing loss. So if they've got a moderate hearing loss at one range and a severe hearing loss in another range, we can have the hearing aid
just flip it whatever you need for that individual person.
Exactly.
How often does the person need to have their hearing retested to readjust what's going on in their hearing?
In our office, we reevaluate our patients' hearing on an annual basis. And the nice thing about the newer type of hearing aids is if we see that that person's hearing has shifted over the course of a year or two or three, that person doesn't have to come in and get new hearing aids. We just reprogram this device to accommodate their hearing at that point in time.
The biggest complaint you get with hearing aids, the way they're worn, the way they feel, the way they fit?
It used to be the way that they felt in the person's ears, but not anymore. We don't get a lot of complaints anymore. We used to have people return their hearing aids. We fit all of our hearing aids with the understanding that if that person cannot wear it, if they're not comfortable with it, if it's not satisfactory, they can return it to us.
How often do they break?
Hearing aids can break. They're exposed to us as humans. There's sloughed off skin and wax and moisture and humidity, so those things all permeate the device. They are electronic, but they don't break nearly as much as they used to.